Hey everyone, welcome back for another deep dive. We're your go-to for those juicy nursing topics, the ones that make you feel like you can actually handle anything clinicals throw at you.
That's right. We're diving into the world of gallbladders today.
Gallbladders, oh yeah, the tiny organ that can cause a whole lot of pain.
And we're not just talking about the basics here.
No way, we're going beyond just, memorizing facts
Yeah.
for your NCLEX or ASI.
We're talking about cholelithiasis and
Oh
cholecystitis.
yes, gallstones and that nasty inflammation they bring.
We're going to dig into those textbooks and study guides we got here.
But really break it down so you understand why things happen the way they do in the body.
So you walk into clinicals feeling like you got this.
All right, so gallbladder 101, I remember from anatomy, it's like tucked under the liver, right?
Right.
But honestly, I always felt like its function was kind of vague.
Yeah.
It's not like the heart pumping blood or the
Yeah.
lungs, breathing.
Right.
So remind me, why do we even need a gallbladder?
Well, think about everything you've learned about digestion. The gallbladder. It's actually super important in breaking down fats.
Oh, fats, okay.
Yeah. Those delicious fatty foods.
Right.
It stores bile, which is made by the liver,
Okay.
and releases it into the small intestine when you eat.
So after that cheeseburger.
Exactly. And the bile acts like a detergent, breaking down those fats into smaller molecules that your body can absorb.
Right, so it's like a bile reservoir ready to go.
Exactly.
But things get a little messy when this system goes haywire, right?
Yeah.
Enter gallstones. How do those little troublemakers even form?
Well, it's not magic.
I was picturing like rocks just appearing out of nowhere.
Right. But the formation of gallstones or cholelithiasis.
Say that 5 times fast.
I know, right? It really boils down to an imbalance in the composition of bile itself.
Okay, so bile's not just one thing.
Nope. Bile is mostly water, but it also has cholesterol, bile salts, and calcium.
Huh.
And when those get out of whack, they can actually start to crystallize and clump together.
So it's like making rock candy, but instead of sugar, you get gallstones.
Exactly.
Ouch, ouch. So how does just having gallstones in the gallbladder turn into cholecystitis, that painful inflammation?
Well, imagine this. You've got these gallstones just hanging out in the gallbladder.
Okay.
And suddenly one decides to take a trip down one of the ducts, leading to the small intestine.
Go.
And the stone gets stuck, creating a blockage, and bile starts to back up.
Like a clogged drain?
Exactly.
I bet that doesn't feel good.
Nope, that backup leads to pressure and irritation inside the gallbladder, triggering inflammation.
And that's cholecystitis.
Exactly.
Okay, that visual really helps me understand why it's so painful. So let's say a patient comes into the ER with, suspected gallbladder issues. What are the signs we should be looking for?
Well, the classic symptom, the one that really sends patients running for help, is intense pain in the right upper quadrant of the abdomen.
RUQ pain.
Exactly. And here's where it gets interesting. This pain often radiates to the right shoulder.
The shoulder, wait, why would gallbladder pain go all the way up there?
It might seem random, but it's actually a reminder of how interconnected our bodies are.
Okay.
The gallbladder shares some of the same nerve pathways with the shoulder.
Oh.
So when the gallbladder's in pain, those signals can get mixed up, and the brain's like, hey, the shoulder hurt.
Oh, that's a perfect example of why understanding anatomy and physiology is so important for us nurses.
It is.
You really got to connect the dots. So besides that RUQ pain, what other signs should we be looking for?
Well, you'll likely see the usual suspects that come with inflammation fever, chills, or rapid heart rate tachycardia.
So pain, fever, chills, tachycardia, got it. But things aren't always textbook perfect, are they?
That's a great point.
Hmm.
Not every patient's going to present with the exact same symptoms.
Right. Some might have like mild indigestion.
Right. Or just discomfort.
While others are, in excruciating pain.
Exactly. That's why a thorough patient history and physical exam are so important.
Makes sense. So we've covered what happens when things go wrong, but let's rewind a bit. Who's most likely to develop gallstones in the first place? I know age is a big factor, right?
It is, especially after 40.
So is it just a waiting game?
Well, it's easy to fall into that trap of thinking it only affects older people, but it's more nuanced than that. We have to think critically about each patient's individual risk factors.
So beyond age, what other factors should we be thinking about?
Let's delve into those risk factors and really understand the why behind them. We were talking about those risk factors, and yeah, age is a big one, but some of them we can actually change, to lower the risk.
Yeah.
You've probably heard that a high-fat diet and obesity are linked to gallstones.
Oh, yeah, for sure. It's like the classic advice, watch what you eat, stay active. But honestly, it's easy to forget when you're like drowning in textbooks, living on pizza and coffee. So remind me, why are those greasy burgers and extra pounds so bad for our gallbladders?
Well, when you eat a high-fat meal, your gallbladder has to work overtime, releasing more bile to break down all that fat. If we keep overloading it with those fatty foods, it can get strained, and that increases the risk of those gallstones forming. And with obesity, it's not just how much fat we eat, it's also about how our bodies process it and store it.
Okay.
Research suggests that obesity can actually mess up the balance of cholesterol and bile salts in the gallbladder,
Interesting.
and that makes those stones more likely to form.
So it's not just about fitting into our scrubs, it's about taking care of ourselves too.
Exactly.
Okay, so let's imagine a patient comes in with classic gallbladder symptoms.
Yeah.
What are the immediate nursing interventions we got to focus on?
First things first, you'll probably see that MPO order nothing by mouth.
Oh yeah, MPO classic.
I know you nursing students learn that one right away, but let's think about why it's so important. Remember how eating makes the gallbladder contract and release bile.
Mm.
Well, if there's a blockage or inflammation, that contraction can make the pain so much worse
Right.
and even lead to complications.
So we're giving the gallbladder a break.
Exactly, a much needed rest.
It's not just following orders blindly, it's knowing the reason behind them.
Absolutely.
Okay, NPO is top priority. What else is on the list?
Pain management is super important too. Those NCLEX and ESI exams, they love to test you on pain assessment.
Oh yeah,
And for good reason, these patients are often in so much pain.
I can imagine.
We need to make sure they're comfortable, not just because it's the right thing to do, but because it's essential for their well-being.
Right.
We might give them pain meds as ordered by the doctor, and then we have to watch how they respond.
Right. Are they getting enough relief? Any side effects?
Exactly. We got to make sure those meds are doing their job.
It's all about that holistic approach, right?
Absolutely.
So I remember from MedCert class that infection control is a big deal, especially with a blockage in bile, building up any specific precautions we need to take.
You're right on the money. Infection control is key, and this is where those NCLEX questions about baths versus showers, come in a quick shower, is usually fine.
Okay.
But soaking in a bath can increase the risk of bacteria getting into the surgical site, especially if the patient's had or is going to have their gallbladder removed.
Got it.
So gentle shower it is.
Okay, so NPO for the gallbladder, pain meds for comfort and infection control, no baths. Got it. What other assessments or interventions are we thinking about?
Monitoring those vital signs is super important. We need to keep track of their temperature. Is there a fever that's not going away? How's the pulse and blood pressure?
Yeah.
Changes in vital signs can tell us if the patient's responding to treatment or if there are any complications.
It all comes back to those core nursing skills,
Right.
right? Observation, critical thinking, and catching things early.
Absolutely. And we can't forget about emotional support.
Oh, yeah, for sure.
These patients are often anxious and scared. A listening ear, a reassuring touch, a simple explanation, those things can make a world of difference.
It's about treating the whole person, not just the gallbladder.
Exactly.
Now, let's talk about treatment. I know surgery is often the answer, but I've also heard of something called lithotripsy. What is that?
You're right, surgery is common, but lithotripsy can be a good option in some cases. It's pretty cool. They use shock waves to break up the gallstones into tiny pieces.
Why, so they just blast those stones.
Pretty much.
But is it a solution for everyone?
I wish it were that easy, but it depends on the size of the stones.
Okay.
If they're too big or stubborn, lithotripsy might not work, and surgery is the better option.
So stone size matters.
Yeah.
And speaking of surgery, what's the usual procedure?
The most common surgery is called a cholecystectomy, which basically means taking out the gallbladder.
Gallbladder out sounds straightforward, but I'm guessing there's a lot involved in post-op care.
You bet. And this is where all that nursing knowledge comes in handy.
Yeah.
Post-op care after a cholecystectomy involves everything: pain management, wound care, preventing blood clots, pneumonia, the whole 9 yards.
I remember those NCLEX questions about early ambulation and coughing exercises. They always seemed like a pain.
Right.
But now I get why they're so important.
Exactly. Getting the patient moving as soon as possible helps prevent those blood clots, which can be dangerous.
Right.
And deep breathing and coughing, even though it's uncomfortable, helps clear the lungs and prevents pneumonia. And of course, we have to watch the incision site, make sure it's healing well, and there's no infection.
So it's way more than just meds and dressings.
It is. It's about thinking ahead and taking steps to keep our patients safe and comfortable.
What about life after surgery? Is it a big adjustment? Can you still enjoy those burgers?
Time to bust some myths. Life after a cholecystectomy isn't as crazy as people think. The body is amazing. It adapts even without a gallbladder. The liver still makes bile, and it flows right into the small intestine.
So it finds a new way.
Exactly.
But does that mean everything goes back to normal, or are there still some limitations?
The body does a great job adjusting, but without the gallbladder to store biodigesting large amounts of fat can be tough.
Ah, okay.
So that's why those NCLEX tips about avoiding fatty foods after surgery are spot on.
So those late-night pizza runs might have to go.
Maybe so.
But it's good to know it's not the end of the world.
Right.
Okay, we've covered a lot from pathophysiology to nursing care, but there's one more thing I want to talk about before we wrap up: gallbladder cancer. Gallbladder cancer, it's not something we hear about every day, but, it's a possibility we got to be aware of as nurses.
Absolutely. While it's not as common as gallstones or cholecystitis, it's definitely serious and we can't ignore it. And here's the thing, the symptoms can be really similar to other gallbladder problems.
Oh, so it could be like hiding in plain sight.
Yeah,
Yeah.
exactly. And that's why our role as nurses is so important. We need to be paying close attention to those symptoms, asking the right questions, and if something seems off, advocating for more tests.
Right. Catching it early is key.
It is.
Wow, this deep dive has been incredible.
Yeah.
I feel like I've actually learned something beyond just what's in the textbooks.
That's the goal.
Connecting the dots between anatomy, physiology, and nursing care really makes it stick.
It's not just about memorizing for an exam, it's about building a strong foundation of knowledge.
Okay, so let's do a quick recap for our listeners who are probably juggling a million things. Classes, clinicals, maybe even a job.
Right.
We've covered the gallbladder from A to Z.
Yeah.
Its normal function, those pesky gallstones, the inflammation, those classic symptoms like the RUQ pain radiating to the shoulder.
Yeah.
And we've talked about how sometimes the symptoms can be sneakier,
Right.
which is why a good assessment is so important.
Absolutely.
We also looked at risk factors and how some things like diet and weight can really affect our gallbladder health.
Right.
And of course, those key nursing interventions, NPO orders, pain management, infection, control, all those things that make a difference for patients.
And those NCLEX and ESI questions.
Exactly. We even talked about life after gallbladder removal.
Yeah.
Busting some myths and explaining how the body adapts.
Pretty amazing.
And we touched on gallbladder cancer, that reminder to always be alert and advocate for our patients.
Always.
So before we wrap up, what's one key takeaway you want our listeners to remember?
I'd say that every patient is different, just like every gallbladder is different. So even though we've talked about the common patterns and risk factors, there are always variations. Don't be afraid to ask questions. Dig deeper and think about those unique things that might affect a patient.
Right, seeing the person behind the diagnosis.
Exactly.
That's such a great reminder. Nursing is a balance of knowledge and compassion.
It is.
And for all you future nurses out there, don't stop with this deep dive. Keep learning. Keep researching. Maybe look into some case studies or new treatments. There's always something new to discover.
Curiosity is key.
All right, everyone, that's a wrap on our gallbladder deep dive. We hope you learned a thing or two, maybe even had an aha moment. Keep those brains working. And remember, knowledge is power, especially when it comes to taking care of your patients. We'll catch you next time on the deep dive.